I'm going to analyze another interesting scene from the Pit. So, for those who haven't seen my other videos, I am someone who has a strong affinity for this show, which I think is a very good portrayal of medicine. And I am tied to it because I am from Pittsburgh, where the Pit is set. And I also did a combined internal and emergency medicine residency at Allegheny General Hospital, where the Pit is also set. So I know a lot about that place. And actually, here's my residency diploma from Allegheny General Hospital, where I was a resident from '02 to '07. So I'm going to play, and we'll see what they have in store for us.
So when did your eyes start bothering you, Miss Matthews?
Sister Grace, please. I'm only married to God.
Of course. I'm sorry.
A few days ago, I thought it was pink eye. Or maybe I scratched it while gardening.
It's a very bad case of conjunctivitis.
So right now, what you're seeing is the fourth-year medical student, Victoria Javadi, taking care of a nun who has come in with a red eye. And when you look at the eye, it's bloodshot, it's red, there's some drainage there. And that makes you think of a condition called conjunctivitis, which is a fancy word for pink eye. And there's different layers of your eye that can get inflamed or infected. And the conjunctiva is kind of the membrane that lines your eye. And it's very, very common to get infected. And sometimes when it's weeping, you can get a culture and figure out what's going on. Most pink eye cases are caused by simple viruses. The same respiratory viruses that give you cough, cold, congestion can also cause pink eye. Interestingly, bird flu can also give you pink eye, and we've seen a lot of pink eye cases in bird flu cases related to the dairy cattle outbreak. So let's see what she does next.
We should send a sample to the lab to direct our treatment. Look up for me. Thank you. Great. I'll put a numbing drop in your eye and check for a scratch with a special lamp.
So you've seen her now take a swab that's going to be sent to the lab for analysis, and now she's putting a numbing drop in. This is really common. It's called tetracaine. That's usually what you use. It stings for a second, and then it numbs your eye so that you can then do things like stain it, for example, to look for scratches or corneal abrasion. So that's a very common thing when someone has an eye issue, to make sure that there's not a corneal abrasion there, because that could get infected, that could get worse. And to do that, you numb the eye and stain it.
And I'll get you to look up for me again. Thank you.
Have you ever considered serving God?
Which one?
Excuse me?
My family's Hindu, so we have like 33 different kinds of deities.
Oh, we have the one.
Some people only need one, right? Okay.
So now you've seen medical student Javadi use a special lamp to look at the eye. And what that does is it kind of puts a special wavelength of light on the eye. And from there, you can see if there's any dye uptake. So they put fluorescein, a little fluorescein strip. It kind of looks like a litmus paper. They put it underneath your, like right there, and then you tell them to close their eye. The dye will circulate around the fluid in the eye. And then what ends up happening is if there's a scratch, you can see it under that lamp because the fluorescence is picked up by the scratch.
Oh, shit. I have a nun with conjunctivitis. Her swab is showing gram-negative intracellular diplococci.
So now medical student Javadi is looking up the results. And remember, this is a nun. And now she's saying they've sent that for a gram stain. So they sent that swab. Basically what they do is they put certain dyes on that swab and then look at it under the microscope. And certain bacteria will be called gram-positive. Certain bacteria will be called gram-negative based on the characteristics of the dye staining process. And that is a way to classify bacteria. Certain bacteria like staph and strep are gram-positive. Certain other bacteria like E. coli are gram-negative. So that's what the gram-positive and gram-negative means. And it comes from a man named Christian Gram who invented the gram stain. And it's one of the fundamental tools that we use in microbiology even now in 2026. And then she says diplococci. What does that mean? Diplococci are a type of shape. So cocci just means kind of a little circular spherical shape. And for many bacteria are cocci, like staph and strep, they're both cocci. Other bacteria have a different shape, like a rod. So E. coli is technically a gram-negative rod. So she's seeing gram-negative diplococci. So diplo, di means two, so two in pairs. So pairs. And when you think that through that classification scheme, and that's what she's doing in her head, she's thinking, what falls under the category of gram-negative diplococci? There's something very interesting, and we're going to figure that out. And it's important because this patient is a nun, and what are nuns known for? I went to Catholic school for 9 years, vows of celibacy.
Gonorrhea? Come to Jesus.
So now Nurse Dana has basically just said gonorrhea. That's what we're thinking about. Gram-negative diplococci, gonorrhea. Now we have a nun that has gonorrhea in her eye. And we're going to let this unravel some more.
The lab must have made a mistake. Maybe it's an immaculate infection. We'll call the lab soup, clear this up. Tread carefully, Missy. There's a nun with gonorrhea in her eye. Seriously, you guys are going to take this away from me? Disappointed in you two.
Grace, this is one of my residents, Dr. Mohan.
Nice to meet you.
You as well.
I wish we could recruit as dedicated and talented young women as you two.
I imagine it's a calling, much like medicine.
Yes, very much so.
Sister Grace, under the microscope, we're seeing something called a gram-negative bacteria.
Is that serious?
It can be, if left untreated. But fortunately, we can give you a shot of antibiotics, irrigate your eye with a liter of saline, and give you drops to use at home every few hours.
How did I get it?
So the appearance of the bacteria in your eye suggests that it's gonorrhea. Traditionally, that's the sexually
I
transmitted.
know what gonorrhea is, Dr. Javadi. I'm a nun, not a numbskull.
Now, medical student Javadi is telling the nun that she has gonorrhea in her eye. And obviously, gonorrhea is a sexually transmitted infection. It's one of the most common sexually transmitted infection. And that means that there's been some way that this bacteria got into this nun's eye. And this is kind of the detective work of infectious disease, is trying to figure out how did this person get infected. So the most common reason would be that the nun is sexually active. Just because you take a vow of celibacy doesn't mean you actually follow the vow of celibacy, and we all know that. But we'll see what this nun kind of elucidates as the source.
Nun, not a numbskull. I do a lot of work at an unhoused shelter.
Are you handling dirty sheets, pillowcases, soiled clothes?
Yes. Part of my day is spent doing laundry, making beds, disposing of old clothes.
Do you wear gloves?
When they're available.
Okay, well, let's get you your shot and set up for irrigating your eye.
So the nun has now related the fact that she does laundry at a place where there are unhoused individuals, and she sometimes wears gloves, sometimes doesn't wear gloves. And there's going to be secretions in that laundry, obviously. And what's happening here, the way people get gonorrhea in their eye, the primary reason they get it is called auto-inoculation. So somebody might have gonorrhea, and they've got discharge from their genital areas, and then they rub their eye. That's the most common way to get it. Sometimes babies can get gonorrhea in their eye when they're passing through an infected birth canal during the time period of birth. That's why sometimes they would give eye drops to babies to prevent gonorrhea from being acquired or taking hold after passing through an infected birth canal. Now, what this nun is saying is kind of an odd way to get it from laundry. You don't expect it to be viable that long, but yes, I guess technically, theoretically, you can get gonorrhea that way if you're touching secretions that are laden with the bacteria and then putting that into your eyeball. You also hear her talking about irrigating the eye. What does that mean? That just means flushing it, just taking saline and pouring it through the eye to get some of the drainage out of there, to get some of the muck out of there. And then they're going to give her injections of antibiotics. So gonorrhea is usually treated with a course of antibiotics. Sometimes an injection of antibiotics. This has become an issue lately, and it's been in the news because we do have strains of gonorrhea that have become highly drug resistant. And recently we just had the approval of 2 new drugs to treat drug resistant gonorrhea, which was a major step forward. But in general, usually it is a shot of a drug like ceftriaxone that we will use to treat gonorrhea, and if the organism is susceptible to that bacteria, and that's what to that antibiotic, and that's what you're hearing them discuss.
A couple boxes of gloves while you're here. It's important to protect yourself. We'll be back.
So now you're hearing Dr. Mohan say that she's going to drop off gloves to the nurse so that they can have gloves at this place where she works. And I think that's important. Personal protective equipment is really important. And remember how many times you might touch your face and not know it. And obviously, there are risks. And that's what Dr. Mohan is there doing, is stressing the importance of personal protective equipment for people who are doing work that exposes them to potential pathogens. So that was the interesting case of a nun with gonorrhea in her eye. And to summarize, most people get gonorrhea in their eye because they're touching their genital secretions and then sticking them in their eye. Obviously, you can also get them if you have genital secretions going directly into one's eye, or a birth canal can provide the entry of gonorrhea into a neonate's eye. This is something that is usually treatable. Increasingly, though, we are worried about drug-resistant gonorrhea. And I think that's an important point to remember, that antibiotic resistance affects all types of infections, and gonorrhea is a major one that we have to make sure we have drugs for. And the other point here is just because someone you don't think has risk factors for gonorrhea or has risk factors for a certain infectious disease, you have to explore, because you will find that risk factor there. And that's what the Sherlock Holmes aspect of infectious disease is often like, that you have to keep uncovering stones, uncovering rocks, trying to find some way that gonorrhea got into a nun's eye.